Hi everyone. Let me adjust my camera a little bit so you can see me a little better. There you are. Robin, your chronic fatigue expert, and I'm reading from today the Chronic Fatigue Syndrome, a treatment guide. And I thought it would be helpful for those that may not know about chronic fatigue and those that have chronic fatigue to know a list of symptoms along with their frequency. This was compiled by a Dr. Katrina Bernay, who is a clinical psychologist, and she herself had chronic fatigue syndrome. And it's garnered from some other reports by other academics. So I'm going to go through this quite extensive list. So bear with me, it's quite extensive. And tell you the frequency of the likelihood you would be experiencing these symptoms as well. So the first one is the general or the physical symptoms, and that would be your fatigue, often accompanied by non-restorative sleep, generally worsened by exertion. You'll find that in 95 to 100% of patients. Nausea has a frequency of 60 to 90%. Irritable bowel syndrome, which includes diarrhea, nausea, gas, and abdominal pain, between 50% and 90% of people with chronic fatigue syndrome. A chronic sore throat occurs in 50 to 90%. Fevers, chills, sweating, feeling hot often, 60 to 95%. Muscle and or joint pain and neck pain, 65 to 95%. So I can see that most clients that would present at a doctor would be feeling like you had the flu. These seem like typical flu symptoms. That's why it often gets misdiagnosed. Okay, let's continue. Bladder, prostate problems, frequent urination. That frequency is between 20 to 95% of clients. Low blood pressure, 86%. Recurrent illness and infection, between 70 to 85% of people suffering with chronic fatigue suffer with recurrent illnesses and infection. Malaise, general malaise, 80%. Heat-cold intolerance, 75 to 80% of clients with chronic fatigue have the heat-cold intolerance. Painful and or swollen lymph nodes. Between half and 80% of people with chronic fatigue have swollen lymph nodes, or they say that their lymph system is painful to touch. Systemic yeast or fungal infection, between 30 to 80%. Fungal infections of the skin and nails, 71%. So you notice, just with that list, and I'm going to continue, they're quite high. Weight gain, 50 to 70%. Increased or severe PMS, 70%. Because I think, like I talked about in my other videos, it can be found in women and men, but more women have chronic fatigue syndrome than men. Swelling, fluid retention, 55 to 70%. That's another high number. Shortness of breath. Subnormal body temperature, 65%. Severe allergies, 40 to 60% of patients report that they have severe allergies. Sensitivities to medications, inhalants, odors, and foods, 25 to 65%. Your sense of smells and everything is on hyperdrive. Difficulty swallowing, between 55 and 60%. Heart palpitations, between 40 to 60%. Sinus pain, 56% of clients reported sinus pain. Rash or a flushing of the face, 35 to 45%. Chest pain, 40% of clients with chronic fatigue syndrome report chest pain. Hair loss, 20 to 35%. Eye pain, 30%. Pressure at the base of the skull, 30%. Weight loss, 20 to 30%. Tendency to bruise easily, 25%. Vomiting, 20%. Some other general symptoms reported with chronic fatigue syndrome are endometriosis, dryness of mouth, dryness of your eyes, pressure sensation behind the eyes, frequent canker sores, periodontal disease, pain in the teeth, loose teeth, and endodontal problems, a cough, TMJ syndrome, mitral valve prolapse, carpal tunnel, serious cardiac rhythm disturbance, piriform muscle syndrome, causing sciatica, impotence, thyroid inflammation, hypoglycemia, like symptoms, and swelling of the nasal passages. And those are just the physical symptoms. So now for the next part is the neurological, the CNS systems, central nervous system related symptoms. The confusion, the inability to think clearly, 75 to 100% of clients. Concentration, attention deficit, 70 to 100% of clients. Sleep disorder or a sleep disturbance categorized as either insomnia, unrestorative sleep, unusual nightmares, anything problems with sleeping. 65 to 100% again. Muscle weakness, 85 to 95%. Headaches, 75 to 95%. Daily headaches, over half clients, 50% or probably even a little more, report daily headaches. Memory problems, especially short-term memories, and that makes sense. You're not sleeping, you're not getting restorative sleep, you're in pain, you don't have the energy in your body to pay attention, so memory problems would be 80 to 90%. I'd say it'd even be 100%. Photosensitivity, 65 to 90%. Disequilibrium, spatial disorientation, dizziness, or vertigo, 60 to 90%. Now, as a person who suffers from vertigo, that would probably be the worst symptom for me. It is awful when you can't even get your balance, you can't even feel like you belong in your body because you're so disoriented. Okay, let's continue with the list. Spaciness and the lightheadedness between 75 to 85%. I hope you're noticing that these symptoms are quite highly prevalent, in about all of them. Muscle twitching, involuntary movements, 55 to 80%. Aphasia or dyscalculia, 75 to 80%. Alcohol intolerance, between 45 to 75%. Seizure-like episodes, 70% of you report that you have seizures-like episodes, and seizures themselves are only 2%. Coordination problems, clumsiness, 60%. That makes sense. If you're not sleeping, you're a little bit fuzzy in the thinking department. Yeah, that makes sense. Paresthesia, that's numbness or tingling or other odd sensation in the face or in the extremities, 25 to 60%. Visual disturbance, scratchiness, blurring of vision, or having just floaters, 45 to 55%. Episodic hyperventilation, 40 to 45%, so that's almost half. So that's troubling to me. If you're just going to hyperventilate, that's scary. Fainting or blackouts, you just faint. Strange taste in your mouth, either bitter or metallic. Temporary paralysis after sleeping, 20%. Earache, 20%. Oh, I'll go back to the strange taste in the mouth is 25%. I think I forgot to mention the percentage. Earache, 20%. Other symptoms reported in the scientific studies were decreased libido, hallucinations, alteration of taste, smell, hearing, and tinnitus. Tinnitus is ringing in the ears. So now for the third component, if those two weren't enough on the symptoms list, we have your emotional and psychological symptoms you'll have as a feature of chronic fatigue syndrome. Anxiety, 70 to 90%. Anxiety is, I would even say, would be at 100% in chronic fatigue syndrome clients. Mood swings, excessive irritability and overreaction, 70-90%. Again, that would be 100% because if you're not feeling well, if you're in pain, if you haven't slept, if you have a history of not sleeping, you're going to have mood swings. It's going to alter how you are psychologically. You're going to overreact because you're in so much pain, you're just going to react rather than thinking. Depression, 65 to 90%. Again, I would raise that up to 100%, in my opinion anyway, that you would have when you have chronic fatigue because you're stuck in that state of pain for so long or the anxiety for so long, you're going to be depressed about being sick. That's probably more likely 100%, but their statistics say 65 to 90%. Personality change, 55 to 75%. Well, that makes sense. You have learned to be resilient with your disease and your pain and your non-sleeping. So I can see where personality change would be a feature. And the last thing that they have on their list is panic attacks, and that's 30 to 40%. And I can see that would be true, that you just panic, that you just get overwhelmed. The Dr. Bernay did note that in most cases, only 1/3 to 1/2 of these reported that they had symptoms all the time. But I would say that there is probably something going on all the time if you have chronic fatigue. You may not have the sleepiness, you may have the post-exertional malaise, you may have what you call a flare because you've done too much. You may be just mentally exhausted and be depressed because you have not slept for 3 days. So while everything doesn't happen on a daily basis, there are 3 or 4, maybe 10, maybe 20 things that are going on a daily basis. So I would encourage you to find some solutions to some of these issues, and I know you want to get better. And I hope this list kind of helped you see that you're not alone, that you're not the only one experiencing these issues. And if I can help in any way, please contact me at Robin, the Chronic Fatigue Expert, and let me know. And I hope you enjoyed this video, and this video has given you some more things to think about and more knowledge about your disease and giving you some insight on what your treatment plan should be and what would work for you or what you need help on. Thank you as always for watching to the end, and have a wonderful day.